Dr. Doug here again today, and what I'd like to talk to you today about is what happens during the first consultation. One of the things we like to do in our office is the first thing we do is we take a digital scan of your teeth or of your child's teeth. And really the main reason to do something like this is so we can better communicate exactly what the issues may be with the teeth, and also just to be able to point it out on a nice screen rather than trying to have to look within your own mouth with a mirror as we're talking to you, or for a parent to look inside the child's mouth. It's much easier for everyone to see and to communicate with an actual representation of the patient's teeth on a screen. So after about a 2-minute scan, which is all this takes, is no radiation, very simple, very comfortable. This replaces the old impressions that we used to take in our profession to actually get a model of teeth. But you can see here a typical patient that we've seen recently, and we can use this 3D image, we can zoom in, move it all around. But what we really want to look at is we can look, for example, at the alignment of the teeth, and we can demonstrate to you the crowding that we have here on the bottom, as well as the crowding here on the top. You can see where the teeth really just aren't straight in that area. And if we put them back together, we can also see how just the bite really doesn't fit together. So for example, we don't see these teeth really zippering together the way they should, and we have some protrusion of the top teeth where they're sticking out a little bit too far in front of the bottom teeth. And these are some of the typical situations that usually we're correcting with orthodontic treatment, whether it be with braces or Invisalign. So what I'd like to do right now is we're going to take you into something called the outcome simulator. And what our iTero scanner is really doing right now is it's taking the current condition of your teeth, of the patient's teeth, and the alignment and the bite situation, and it's actually going to start moving things around. It's going to start recalibrating where the teeth sit and the alignment of them. And the really neat thing is that we can now, within a couple of minutes, what you're seeing happen right in front of you, run a simulation, which is fairly accurate, and give you an idea of what your teeth would look like, or what your child's teeth would look like at the conclusion of orthodontic treatment. So instead of just showing you standard images of what a good bite is, or showing you plastic models of what a good bite is and comparing it to your current mouth, your child's mouth, we can actually show you your exact teeth on the screen here, before and after, of what they should be like once treatment is completed, which is a really neat thing which we weren't able to do before. So as I was talking here, you can see the simulation is actually already run. And what I want you to see is on one side here we have the current dentition, it says, which is the current position of your teeth. And if we just look from the front here, again, we don't see really much of the bottom teeth here. That's what we typically call an overbite. And you can see in the simulated outcome, we can now see more of the bottom teeth. And if we look from the side view, okay, we really see how the bite, nothing really fit together here, how the teeth just really didn't mesh together well. And after treatment, we can, again, now we see this kind of zippering format where the teeth just kind of zigzag and fit together between each other, which is really what we want when treatment's done. And also we can look at top. Again, you see the nice alignment that's been created here versus the crowding or the crooked teeth that we had in the beginning. And we can do the same thing for the bottom. Okay, and again, you see the nice alignment here versus the crowding that we had in the beginning here as well. But this is a really powerful tool for communicating with patients. And the other thing we can do is we can just flash before and after. Okay, so again, you can see your current teeth before and after. And again, from all the different views that we had before, just going before and after. And a lot of times what we'll do is we'll even let the patients play with this themselves and just kind of play around with the cool technology. And because it's a touch screen, a lot like an iPad, but it's a great way to really visualize how your teeth can look after treatment. And what we can even do is there's a share button up here. We can actually email you your simulation after the consultation, where maybe mom or dad couldn't come, one parent was there, the other one wasn't, your husband or wife was not able to come to the consult, and you can share with them at home exactly what we talked about and see the before and project it after, to better communicate, if you both couldn't be in for the consultation. So I hope you enjoyed this video. I hope that it gave you a little clue into what we like to do in our office, and give us a call, and we'd love to see you for a free consult. Have a great one, guys. See you next time.